Imagine a heart surgery so complex that it is named after the largest land animal on earth. Elephant trunk surgery. What makes it so rare? Why is it considered a life-saving innovation for aortic aneurysms? Today we are going to deep into one of the most fascinating heart procedure that few people know about. Hi everyone, I am Dushyant Maggu and you're watching MedNews India, where we decode complex surgeries and treatments with India's top doctors. And today we have with us a cardiac expert who has performed some of the most advanced cardiovascular surgeries, Dr. Vishal Pingle, a cardiothoracic and vascular surgeon, one of the few specialists in India who has hands-on experience with elephant trunk surgery. Doctor, for the common viewer, what exactly is elephant trunk surgery and why is it named that?
So the frozen elephant trunk is the surgery where we replace the aorta of the patient. So let's understand what is aorta. Aorta is a big pipe that starts from the heart and carries the blood to the entire body. This surgery is called frozen elephant trunk because of the graft that we use for the surgery. So what is the graft? Graft is a tube that we use for the surgery. This is a specialized tube that we use for the surgery. This part of the graft resembles the trunk of the elephant. Hence, it is called as the frozen elephant trunk surgery.
In what kind of heart condition is this surgery recommended, especially when compared to traditional aortic aneurysm surgeries?
So, the patients with either aortic dissection or aneurysm require frozen elephant trunk surgery. What is dissection? Dissection is a case wherein there is a break in the aorta and the blood collects outside the aorta. Aneurysm is where there is a dilatation of the aorta. In conventional surgeries, we had to do the surgeries for the arch of the aorta into two stages, wherein in the first stage we used to replace the ascending aorta and the arch of the aorta, and the second surgery was for the descending thoracic aorta. With the frozen elephant trunk, now we can replace the ascending aorta, the arch of the aorta and the descending thoracic aorta only in a one stage itself. This is the beauty of the new frozen elephant trunk graft.
It is known to be a multi-stage procedure. Could you break down how this surgery is actually performed step by step?
Yes, indeed, it is a multi-stage procedure. So we divide this surgery into four stages. Stage 1 is where we assess the aortic valve. If there is problem with the aortic valve, we repair the valve. Then in stage 2, we replace the ascending aorta, the arch of the aorta and the descending thoracic aorta using the frozen elephant trunk. In the third stage, where we restore the blood supply to the brain vessels. And in fourth stage, we restart the circulation of the patient, and that completes the surgery.
What are the biggest risks or complications associated with elephant trunk surgery and how do you mitigate them?
This is a very complex and life-saving surgery. As with other cardiac surgeries, this is also associated with few complications. Bleeding and infection are the commonly seen complications. To avoid bleeding, we ensure that during surgery itself there is no active bleeding point that is left behind. To avoid infections, we have got antibiotics placed in before and after the surgery. The more specific complications with the frozen elephant trunk are stroke, paralysis of the lower limb, and kidney failure. Now, how do we tackle this? To avoid stroke, we have got a special machinery that keeps checking the oxygen level in the brain continuously during the surgery. At any point, if we feel that the oxygen level in brain is going down, we have got strategy in place to improve the oxygen in the brain. To avoid paralysis, we have got a special machinery that measures the pressure in the brain and the spinal cord continuously during the surgery. At any moment, if we feel that the pressure in the brain is increasing, we have a strategy to reduce the pressure in the brain. Similarly, for the kidney failure, we have got a strategy in place to ensure that the kidneys receive adequate oxygen and blood during the entire surgery. So, for any complication that we foresee, we have got a fallback option or a strategy in place to avoid complications.
So doctor, how rare is it? And are we seeing more centers now adopting this technique in India?
So you must have realized that frozen elephant trunk is a very complex procedure. So it needs a special kind of equipment for the surgery, also needs a special kind of expertise in this procedure. Not every institution has expertise and technical support for this surgery. Though there are many centers who are coming up or trying to come up with some technicalities to help this surgery, there are very few centers in India who actually perform these surgeries. There could be hardly 4 to 5 centers in the entire India who routinely perform this kind of complex surgeries.
If you found this conversation eye-opening, don't forget to like, share and subscribe to MedNews India. For anyone facing complex cardiovascular issues, always consult an expert like Dr. Vishal Pingle to explore the safest, most advanced options available. Until next time, stay healthy, stay informed.